Hi, everyone. My name is Dr. Rachel Altvader. I am a licensed psychologist in Maryland, Washington, D.C., and Virginia, and a registered play therapist supervisor. We are amidst an extremely anxiety provoking time as we are entering uncharted territory with the teleplay therapy world. And I wanted to provide some guidance and support for all of you through this extremely challenging time. You all are holding on to a tremendous amount of anxiety and providing a significant amount of support to your clients, your communities, your families, your friends, and hopefully yourselves. I'm providing this training for all of you because I want to give as much information as I can to guide you in all of the amazing work you're doing. I know many of you have turned from a predominantly or only in-person practice to a predominantly or only online practice, making sure that we have the training that we need to provide competent and clinically sound care is imperative. I hope these foundational skills help all of you feel a little bit more confident in your abilities to provide teleplay therapy. I will be providing an introduction to teleplay therapy, and we're going to talk about some considerations and preparations for your practice. The first part of the presentation is talking about telemental health. We're then going to discuss privacy considerations and issues surrounding teleplay therapy practice, how to increase comfort in the digital platform, and establishing some interventions. My hope with the interventions is to teach you all how to fish. There are a plethora of beneficial and insightful interventions that are being implemented and discussed. I want to try to help you all figure out how to come up with some of your own interventions that fits your particular theoretical orientation and clinical style. I first want to note the importance of checking with your state and national licensing boards. Each board has a different either code or standard or guidelines surrounding teletherapy. So just be sure that you are practicing within the ethical requirements of your boards. It's also important to just make note of this when other people are talking to you about ethical requirements. Different disciplines are going to have different approaches, while for the most part, ethical care is going to remain pretty similar across the board. There are varying degrees of guidance and standards, so just be aware of that. Also check with your malpractice insurance. Some malpractice insurances already cover teletherapy, some don't. It's an additional add-on. That's always important to make sure that you are covered with all of the services that you're providing. Additionally, insurance companies, some will reimburse for teletherapy and some either won't or might at a different rate. So just make sure that you're checking in with the insurance companies that you are credentialed with so that you are able to be reimbursed for the services that you are providing. So definition of telemental health is the provision of psychological services using telecommunication technologies, and that can be from a variety of devices. We are going to specifically be talking about video conferencing today. So when you first start teletherapy, make sure that you and your client have the necessary equipment. I know this sounds silly, but sometimes once you actually start doing it, you recognize that you don't have all that you need. So just be sure that you have all that you need. You can use a computer or a smart device. For a smart device, you can use a phone or a tablet. Make sure that your device has a webcam and speakers either already within that device or making sure that you have additional add-ons. Sometimes people have webcams that are separate from their computer. Also, a plug for your device. Our devices lose battery quickly when we are providing teletherapy services. So just be sure that you have a plug, and if possible, that your client does as well. Sometimes the device is going to be moving around the room. It's a little bit more challenging to have something plugged in, but that's something that's helpful to keep in mind. Also, a stand. I have one right here where you can put a tablet or a phone on here. So it helps to just have it positioned in one spot, um, unless you're moving around the room. But even if you are moving around the room, you can move the stand along with you. It's just helpful to try to have as stationary of a setup as possible. It kind of avoids the roller coaster ride and vertigo that some people may have with all the movement. Also, be sure to check and see if you and or your client will need to download an app on your smart device. Some teletherapy platforms offer that ability. Some you can enter directly to the website from your smart device, but just check beforehand. It's good to give your client a heads up if they will be needing to download an app, and giving instruction to them prior to the appointment so it doesn't interfere with the session. It's also good to close out of all the programs and restart your browser. It kind of just refreshes everything, and it allows for less noise in the background to potentially take away from some of the power that the teletherapy platform needs to run smoothly. Also, make sure any smart devices around are turned off. Our phones, Alexa, Google, things of that sort, of even smartwatches. Just be aware of what's around you and what could hear some of what you are saying. This isn't meant to be paranoid, but ultimately, if any device is voice activated, it is listening at all times to see if you are going to be giving the command. As soon as you give the command, it recognizes that it needs to do something. So just be aware of that, because we don't want additional confidentiality issues when we have our own devices on around us. Also, be sure of the orientation of your device and how that may impact where your camera is positioned and ultimately where you're looking. If it is horizontal, sometimes it makes it look as if you're looking to the right or to the left. For some clients, that's okay. They don't necessarily mind. For some clients, it is bothersome. So just be aware of that and potentially ask your client about where your eyes are looking, because it definitely can inhibit the direct eye contact that you're trying to make with your client, which may impact some of the services for some clients. At the start, you have to attest your client's location to make sure that they are within a state that you are licensed and can provide services. Sometimes there is state reciprocity where if you're licensed in one state, then you can provide services in neighboring states or just other states, depending on whatever the regulations are. Make sure that you check to see where people are, because you do not want to be providing services to someone who is outside of those states that you're licensed. For international teletherapy, consult with your state licensing boards, the country licensing board, and your malpractice insurance to make sure that you're covered. With my own experience, other countries tend to be a lot more lenient than the United States in regards to receiving teletherapy services. It's just good to make sure that you are practicing ethically. So make sure that you are covered before you start providing services to clients outside your jurisdictions. It is very challenging to try to describe something confidently to caregivers when you are not fully sure of the efficacy or practice yourself. So when you first explain teletherapy, make sure that you are able to establish some comfort and familiarity yourself first, and then you can confidently express the benefits, the limitations, but the overall practice with teletherapy. Something I always love to add is that children are immersed in the digital world. Children love to be online and to navigate their smart devices. So I do like to tell caregivers that children are experts in this world, and it is the modern facilitator of communication. Play therapy is all about meeting children where they are and speaking their language, and utilizing technology is doing just that. So I do like to articulate that to parents so that they are aware that while there's an adjustment from in person to online, we are still focusing on the core principles of play therapy and helping children feel a sense of normalcy and a sense of mastery and control. You also want to consider what types of sessions that you would like to provide. Do you want to continue individual sessions if that is what's occurring? Do you want to continue parent-child sessions if that's what's occurring, or family sessions? Do you feel like this new platform will alter your delivery of services? Regardless of what you decide, just make sure that you're checking in with what your clients' presenting concerns are and what their current concerns are, to make sure that you're still providing the space for them that they need. Because it's an adjusted setting, it might be more challenging to provide the services that you've been typically providing. So just make sure to take it on a case-by-case basis to see what's going to be best for each of your clients. You also want to figure out how you're going to structure the session with the caregivers. I do like to start by presenting a plan at the very start with the very first session. So if we think about providing intakes, what I often do is explain to families how the intake is going to go. We're going to first review some policies and procedures. I'm going to have you sign some documents, and then I want to learn more about what's going on for you, your child, or your family, depending on the circumstances, of course. But you lay it out, because when there's a plan in place or there is familiarity, it helps combat the uncertainties that so many people face when coming to services in general, but also with this teletherapy platform. So being able to take a second to lay out, these are the important things that we're going to cover, and this is how it can go, will also help you establish a sense of control yourself within an unfamiliar platform. Not suggesting for you to completely control the session. However, it does allow you to feel a higher sense of confidence and comfort when you are not in person with someone. And we'll talk a little bit more later about coming up with a game plan. Also, checking in at the end. Do you want to check in with a parent at the end? It's going to be clinician by clinician preference. I, generally speaking, don't like to check in with parents at the very end of sessions, because I never want the child client to think that I am talking about them or divulging all of the session content at the very end. However, it could be helpful, especially with this change of platform, to just have these transitions from starting the session to ending the session. It's kind of like going to the waiting room, getting your client, having your client come back for the session, going back out to the waiting room. So you can look at it in that regard, just figuring out, like I said before, what's going to work best for you and what's going to work best for your clients. The game plan, how to start the teletherapy session, right? So figuring out what's going to be best for your practice and what's going to make the most sense for your clients. It's important that you orient yourself to your client's therapeutic space at home. Just like when we start play therapy services and a child tends to spend time looking through the room, familiarizing themselves with what you have available in the office and ultimately what tools they're going to end up using. It's a process when we start play therapy services. Similarly, when we are just starting teletherapy services, we have to reorient ourselves to that process. So asking your client if they feel comfortable to give you a little tour of whatever area they are in, so you can at least form an idea of where you are in relation to the client, in relation to the room. Our clients know their houses, they know their spaces, we don't. So it is important just to be aware of where things are so that you feel more comfortable easing yourself into that particular environment. I do like to touch base with parents on setting up a private space, and I'll get into that in a little bit, but that is included in my game plan with parents at the very start. I also allow parents to ask any questions they might have and provide any suggestions that they might have for any digital or traditional toys they would like to incorporate in their session. Connection issues are inevitable. When they occur, remain flexible and calm. It is very easy to start to feel panicked, especially when you are unfamiliar with the platform and the process. Take a deep breath, and we'll get through this. There's a couple additional ideas that can help that we'll get into as well. From the start, inform your child and their caregiver of this possibility. Include this in your informed consent as well, which we'll talk about that shortly too. There might be sound issues, there might be connection issues. See if you can troubleshoot from the very beginning. A lot of times, if there's a sound issue, it usually starts at the very beginning. It might occur when some clients are transitioning between things on their end as well. For whatever reason, the audio can shift a bit. Try to navigate that from the start. And the hope is that throughout the rest of the session, it will be okay. But sometimes there are other issues that arise. So troubleshoot a plan with your client and their caregiver in the event that this occurs. You want to have fast internet connection. Teletherapy platforms sometimes take a lot of power, so you want to try to have the connection as strong as possible. Many people use Wi-Fi. There's no problem with using Wi-Fi. However, if there are connection issues, using an Ethernet cable can potentially help. What that is the cable that connects directly to your router versus having it on a Wi-Fi network. Lower the resolution of your video if you're experiencing poor quality, because when you lower the resolution, it decreases the amount of data that's being processed and ultimately can help with that video quality. And then familiarize yourself with another platform as backup. I'm going to be talking about a couple different teletherapy platforms. So do some research into a variety of them and see which one you want to have be your primary means for teletherapy and what could be a potential secondary means for teletherapy in the event that it's needed. I've jumped onto a teletherapy platform before and had difficulties, and my client and I just moved over to a different platform and were able to continue the session. For insurance companies, there are going to be differing requirements. So this is not the standard for every single insurance company. Just keep that in mind. You will need to change your place of service code to 2. For traditional office visits, it is code 11. You would just need to change it to 2. Sometimes with EHR systems, electronic health record systems, it defaults to office visit if that's how it's set up. So you'll need to just change the place of service code to the proper code, which is 2 for teletherapy. There's also modifiers that need to be added as well on your claims. For a lot of insurance companies, it is 95. That is the synchronous telemedicine with audio and video. Some insurance companies want the modifier GT. And for some insurance companies, the place of service code is actually used instead of GT. So before things get too complicated with all of your insurance companies and this new information, just be sure to check to see what their standards are. But just know that there will have to be some alteration to your claims before you send them to your insurance companies. You also want to come up with an informed consent. I do want to say there are a variety of examples online, so be sure to check what is out there and use that as a model to create your own. I know some EHR systems, like Simple Practice, for example, there are some forms that are already added to the system that you can use and modify to fit your practice. So just be aware of that. But these are some things that you want to make sure you're including in your informed consent. Just like a typical therapy informed consent, modifying it to the teletherapy platform. So you want to explain teletherapy practices in this consent, how confidentiality will be maintained and any limits to confidentiality, that you will be using a HIPAA compliant platform. That's very important. Any benefits, risks, or limitations that might arise with utilizing a teletherapy platform. Some we've already talked about with the connection issues and any other issues that may potentially arise. Also just being online. While we utilize HIPAA compliant platforms to assure confidentiality, we are on a digital platform and there are a lot of uncertainties. So it's important to just make sure that you articulate anything that could potentially be a limitation or a risk for your clients in engaging in services in this way. It's also important to touch base on client rights. For example, they have the right to refuse or stop services at any point in time. Similar rights to traditional informed consent documents for the therapy that we provide in office. You also really need to have an emergency contact. When working with children, parents will be the emergency contact. Just make sure, though, that you have an emergency contact. And then also what will happen in the event of an emergency. And touch base on this a little bit, but having some contingency plan in place in the event that you have any technological issues arise during your session. When choosing a platform, you need to be sure that there is a HIPAA business associate agreement in place. Some teletherapy platforms already have this in place with the platform. Some platforms are HIPAA compliant if you add this on, if you pay for it or if you sign an extra document. Just be sure to check more in depth with the platform that you're using and see if there's anything that you need to do additional to assure that there is a business associate agreement in place. Here are just a few of the platforms that people utilize. This is not an exhaustive list. It's just good to see some of the possibilities that are out there. With privacy issues, you want to make sure that you have a secure network, meaning that it's password protected. If you are on a network that is open to the public or is not protected, people can enter that network and gain access to what you're doing. So be very careful about that. As I said before, have the child orient you to the space. It affords you the opportunity to see where they are and make sure that you are aware of where you are in relation to their space as well. Inquire about who's home and where they are in relation to the child. It will give you more guidance on how to help your client maintain a sense of privacy at home. Do they have a sibling in the room over and the walls are very thin and they can hear everything that the client is saying? It's just very important to make sure that you're aware and to see if there's anything that you can do to help the client establish a greater sense of privacy. Something that can be really fun for starters is to make a do not disturb sign and have the child hang it on the outside of the door so that it kind of mimics the therapy sessions. I know a lot of us have do not disturb signs. I've also started having parents make do not disturb signs as well, because a lot of them are working from home at this point in time and are also having quite a few disruptions in their own need for privacy. So families seem pretty excited about making it a family activity to make a do not disturb sign for each person to hang on their door when they need a sense of privacy. It's good for connection too, of course. Ask caregivers for help in creating a confidential space and asking them who is close by, asking if maybe people can go to a different area for the time being. Now, of course, there's no guarantees, so just continue to remain aware of this. Whether it's we try to implement everything we can and there just still isn't a sense of privacy, or if caregivers want to hear what's going on in sessions and tell you that things will be secure and confidential when in fact they aren't. Also, just being aware of any individuals within the home that might not be aware that the child is receiving services. In some instances, families will not tell some members of their family that people are receiving therapy. So just be aware of that as well, because that could arise. And if a sibling, for example, barges in on a session and has no idea what they're doing, it could just create a lot of discomfort for the client. So how can we create a private space for our clients and, of course, for ourselves? Make sure that the location that you're using and that your client is using is secure. Of course, we can't guarantee that a client will have this privacy, but we can try everything we can to maintain as much confidentiality as possible. Continuing to remind families of the confidentiality policies is a good refresher. Some kids like to use noise machines to go to bed. So ask your clients, do they have some type of noise machine that they can use outside their room to help mitigate some of the noise? Also, remain mindful that you are entering a very private space. We are now entering our clients' homes, and they may love it and they may feel very uncomfortable about it. So just be mindful of that, maybe process it with your clients to see how they feel. I've been informing clients to let me know if there's anywhere in particular that they don't want me to see, or to just remain mindful themselves that they might not want me in certain areas of their house and that I respect that. It is recommended to use headphones. There are quite a few kids who have the wireless headphones, which would probably be best because if they're moving around, then there's no cords holding them back. It just helps with an additional layer of privacy because when they're wearing headphones, those around them can't hear what the therapist is saying. And it also just allows for more privacy within the conversation in general. It also helps us to just hear the clients a bit better. When they get further away from devices, it's really hard to hear. So when they're wearing headphones, it's the same volume unless they wander way too far away for the Bluetooth to even pick it up, but just something to keep in mind. Also, remind children to just be aware of the volume of their voice, that ultimately they may not want people in the home to hear some of what they're saying, and that the walls are thin. Kids don't come into the therapy session and recognize all that we do to assure privacy and confidentiality. I mean, sometimes kids might ask questions about the noise machines outside the office space, but they aren't necessarily paying attention to that privacy. That's our job. So just be sure to talk to your client about it, even if briefly. Maintaining confidentiality in live games. There is a possibility that you feel comfortable enough to enter the virtual world with your client where you have a login and they have a login into a particular game, for example, Roblox. Do not communicate with your client within that platform. Just be sure that you are only conversing with your clients through the teletherapy platform. Some clients, especially younger clients, are going to be moving around the room and moving the camera. So in the game plan that I brought up a couple minutes ago, it is important to iron out the spacing where the client might be moving. Of course, it's not always going to be predictable. Sometimes clients are going to be moving around the room, especially if they're more hyperactive or dysregulated. It would probably be a good idea just to give your clients a heads up from the start where to position you and maybe when to move you, so that way you're not going on a roller coaster ride. Regulating dysregulated and hyperactive children can be extremely challenging. If it makes sense for the therapeutic goals that you have in place to have parents present, it could be beneficial. as they could help regulate on their end. Otherwise, if you know that you have a client who is hyperactive or dysregulated, being sure to have some activities in place that you maybe could utilize together to de-escalate some of the intense energy or emotions that they are experiencing. Something that you're going to have to take on a case-by-case basis, of course, but perhaps you can do some of the activities that you already implement in your sessions and apply it to the teletherapy platform. Something else to pay close attention to is the pacing of your sessions, that there are sometimes silences or a lag in people speaking. So then people start to talk over each other by accident or on purpose. So try to figure out what's going to work best for each of your clients. Do know that at the start of some of these teletherapy sessions, there might be more dysregulation because this is unfamiliar. Just like if a child comes into a play therapy room and very quickly explores the room, it might be just to decrease the level of anxiety because of the uncertainty associated with this space. So applying this to the teletherapy platform, this could be occurring. Remain mindful of that. And as I said, default to what you already do in session with your client and try to find a creative way to adapt it to this particular platform. Our fur babies, they love to talk. So if you have a dog specifically, or any other animal that makes quite a bit of noise, a bird, perhaps if you feel comfortable naming it at the start of the session. And the client may also have a fur baby at home that could be joining or disrupting a bit, and that's okay. It's good to just name it, again, if you feel comfortable enough with divulging that information. If you want to maintain a sense of privacy yourself that you have an animal, hopefully your animal will not be making noises. Ethics codes. Regularly review your national and state board ethics guidelines or standards, whatever they have implemented. They change. And especially with all that's occurring with teletherapy right now, I anticipate a lot of boards will be tightening or adding on to their regulations in the future. So remain mindful of these changes and stay on top of any edits, additions from your ethics codes. The Association for Play Therapy also has a best practices document, and there is a section in there on use of technology. For all the play therapists, be sure that you are reviewing this best practices document and practicing within the guidelines. Also, obtain ongoing consultation and or supervision. It is important that you process with your colleagues, with your supervisors, whoever it may be within your practice or your discipline, to assure that you are practicing within your requirements. This is a wonderful website that has an extensive list of codes of ethics and guidelines on telemental health, e-therapy, digital ethics, and social media. So check this out, see if you can find your licensing board. I do not believe that it is state dependent. I think these are more the national guidelines, if I'm not mistaken. There are a lot of concerns that have arisen with this shift adjustment to the teletherapy world. There's a lot of unfamiliarity with technology in general, and specifically surrounding the teletherapy platforms. Another huge concern for many is clinician competence. This is uncharted territory, and there is not a lot of research and knowledge and practice in this area. So it is very challenging to feel confident in what you're doing when you don't have the necessary training. And ultimately, as a profession, we need to obtain trainings in what we're doing to make sure that we know what we're doing and how to go about doing it. Safety and privacy concerns, I already touched based on that a little bit, but there is unfamiliarity with teletherapy and how a client's privacy might be impacted. How can we increase our comfort? It is so important that you continue to remind yourself that you know more than you think you know, and you have a lot of valuable skills, insight, and creativity. I know this is a very anxiety provoking time. Do not forget to breathe. Do not forget to take care of yourself amidst all of this. For starters, acknowledge your biases and discomfort. It's going to get in your way if you don't name it and if you don't reflect on it. Ultimately, the more uncomfortable you are, the harder this transition is going to be. If you are able to maybe jot down some of the things that you're worried about or that you're apprehensive about, reflecting on that can really help decrease the anxieties and also maybe help challenge some of the biases and discomfort that you have. Everyone is entitled to their own feelings and thoughts about this. I know technology is an unfamiliar world, and that is okay. The only thing is you're moving into this world. It is important that you acknowledge those biases first before you step in. As I mentioned, some of the core principles of play therapy are to meet children where they are and to speak their language. Also, as I said, children love the digital platform. They are immersed in technology. Children are already forming and maintaining connections online. This is probably quite comfortable for them. Some of our apprehensions may center around our clients' comfort with transitioning. They might be more comfortable than you realize because now we're entering this space that they have been for quite some time. And it's okay to allow them to lead you through that. Reflect on the core tenets of your theoretical orientation. During moments of uncertainty and panic, it is easy to just default to whatever techniques you can learn and just apply it. Center yourself, reflect on the therapeutic practices that you're already providing, and see how you can use those core tenets in the digital world. The child is the expert, and they enjoy being there, and that is exactly where we want them to be for play therapy anyway. So just keep that in mind through all of this. This is a perfect opportunity to have your clients teach you about their technological interests and guide you in any technological exploration. There are screen sharing opportunities in some of these platforms where you can enter the digital world together. I also had mentioned live games. There are a variety of different ways that you can incorporate technology with clients in this teletherapy platform. As always, when you are learning something new, obtain additional readings and trainings. It is so important that you know what you're doing and that you are practicing competently. And explore technology yourself. Just to familiarize yourself with the possibilities. It could be very beneficial. When you are establishing interventions, it is important to remember that one size does not fit all. You want to make sure that whatever interventions you're using apply to the presenting and current concerns that your client is encountering. Entering an unfamiliar space and defaulting to something just to make sure that you're having a session still with the client to maintain some sense of normalcy can be helpful, but also you might be missing so many opportunities of providing therapeutic care to your clients and really gaining more insight into their world. So just be aware if there's a particular intervention that works or that sounds like it could work for your clients, great. Use it, try it, implement it, and just make sure that it really is because it can help your client and not because that's the only thing that you could find or think about that could apply somehow. Maintaining normalcy during uncertainty is imperative. We know that routine and schedules and structure and consistency and predictability are so important for clients. So, whatever we can do as we navigate this change can be quite helpful. When choosing toys, you can either have clinician prepared or client prepared. With clinician prepared, you can prepare prepackaged home play therapy toy kits for your clients that they can have at home, and those are the tools that they'll use for the session. You can choose particular toys from your playroom that you can utilize on your end, and the child can guide you. Or you can ask your client to choose specific toys presented at home. So if you know that there's a particular intervention that you want to implement, you can ask your client to get a stuffed animal, to get their Legos or some expressive arts materials. With client prepared, they can choose what they want to utilize in their session. They have the freedom to reflect on what they have at home and bring in what they want to the play therapy space. And there's no right or wrong. All of these could be very beneficial approaches to teleplay therapy. When implementing non-directive interventions, allow the child to guide you. They can guide you through digital play, or you can set up a non-directive play therapy space. You can ask that they have certain toys there because we carefully select toys already. So we can say, in preparation for the play therapy session, you would let parents know this, of course. Please be sure to get these following items and set them up in, maybe a circle. That could also set a nice parameter for the client to stay within that particular circle. And then they can choose what they want. Similar to teaching parents how to do filial play therapy and implementing the non-directive skills at home. Also, do additional research in between sessions about unfamiliar games. If you are sticking with the non-directive skills, then you don't want to ask a bunch of questions in non-directive play. So if there's something that you don't know, you can look it up. If you are doing a directive intervention, though, you can absolutely ask more questions. I personally like to ask my clients more questions about what they are playing and what they are doing within a digital platform. If it's a game that I'm not as familiar with, I will ask more questions. However, if this is happening in the non-directive world, then reserve those questions. With directive interventions, you want to decide whether it's going to be clinician-led or child-led. And what that means is, are you going to take charge on your end? Let's say you're playing a game online together, that you would open it up on your side and screen share, or would you prefer the child to do that? It's also important to remember that you have a variety of directive interventions that you incorporate with your clients on a daily basis. As I mentioned, just continuing to find ways to apply your typical interventions to the digital platform. There's also digital adaptations of traditional toys. As I just mentioned, you might be able to go onto a website and play a card game together. So finding different digital means. There are also a plethora of apps available that can be implemented during sessions, where maybe you have your screen up and the child has their screen up, and you have a smart device that is engaging in a different game. So you are talking through the teletherapy platform and engaging in play through another platform. Again, for privacy reasons, just assuring that all conversations and communication occurs within the teletherapy platform. And entering live games. This is something that I encourage you look more into before you start to implement, and ask clients if there are any particular games that they're interested in. Maybe they can direct you to download the app, to get into the app, and can show you around. How cool is that for play therapy? It could give you a lot of very beneficial information. I have worked with a variety of clients who have shown me a lot of information in their digital worlds, and it is really cool. When ending a session, you want to give time warnings like you usually do. If you usually do, we have 10 minutes remaining, we have 5 minutes remaining. Be mindful that you might not actually see the time on your device. Some of the teletherapy platforms end up removing the time and any extraneous stuff until you actually tap the screen. So if that's a possibility, great if you can just tap the screen to quickly check the time. Otherwise, make sure that there is a clock close by so you can keep track of time. It is very easy to lose track of time. Also, establishing transitions from therapy space back to home space as recommended before. Perhaps you can have a parent enter at the very end, similar to a handoff back to parents in a waiting room. You can reflect on the process and inquire about future adjustments with your clients if that makes sense for the therapy that you're providing. If you are doing non-directive play therapy, then you're not going to necessarily reflect on that process. However, you can always talk to parents about the layout and see if they have any input, if the child says anything over the next week about their experience. Of course, encouraging parents not to have them ask their children a bunch of questions, because we don't want them to ask a bunch of questions after any therapy session unless that is something the client initiates. I am sending you all best wishes as you navigate this teleplay therapy world. Breathe through it and just remember that you got this.